United States ranks poorly on infant mortality, maternal mortality, and maternal morbidity compared to other high-income countries. Access to affordable, high-quality maternity care is critical for preventing these adverse outcomes, yet many people face barriers to timely, adequate care. Today, I'll share findings from a collaboration between UIC and the Illinois Department of Public Health that investigates maternity care access in the state of Illinois. First, we developed local maternity care access measures that give more weight to closer providers. These measures account for patient travel distances to birth sites, health centers that provide prenatal care, and maternity care clinicians. They also adjust for longer travel times among households without vehicles and for social determinants of health. The maps show maternity care access classifications across zip code tabulation areas, which are geographic representations of zip codes. The shift from dark blue and light blue toward red and orange reveals declining access between 2015 and 2023. These local measures can help policymakers target where access barriers are greatest. Next, we estimated the effects of obstetric unit closures on access, delivery hospital choices, and health outcomes, including by the birth patient's race and ethnicity. We focused on closures of patients' first or second nearest obstetric units. We found that non-Hispanic Black patients disproportionately experienced these nearby obstetric unit closures compared to non-Hispanic white and Hispanic patients. We used event study methods from economics to compare birthing patients who experienced nearby closures to those who didn't. In these graphs, the horizontal axis shows calendar quarters relative to the quarter closures. Positive time periods show post-closure effects, which reflect a combination of temporary disruptions and more permanent changes. The vertical axis shows changes in outcomes normalized to 0 in the last period pre-closure. The left graph shows that patients experienced about 20% decreases in birthing hospital access scores on average. The right graph shows that after closures, patients traveled an average of about an additional 2 minutes or 10% further to their delivery hospitals. Patients delivered at higher level hospitals on average, in part because the closing obstetric units tended to be at lower level hospitals. The left graph shows that more patients delivered at level 3 hospitals, which operate neonatal intensive care units and can provide the most complex care. The right graph shows that on average, patients didn't experience changes in lower cesarean deliveries, except for temporary increases among Hispanic patients. We also didn't find significant effects on preterm birth or severe maternal morbidity on average. However, limited statistical precision means we can't rule out small effects, and more recent and future additional closures may have greater impacts. What do these findings mean for policy? While obstetric unit closures meaningfully reduce access, preventing closures alone likely won't substantially improve maternal and infant health. Improving these outcomes likely requires a broader policy approach that addresses maternity care access and quality, as well as social determinants of health. Thank you.